Hi, everyone. We're coming to you today from the University of North Texas Health Science Center at Fort Worth. I'm Noah Drew, and today I'm being joined by Josh Lindsley and Connor Reynolds. They're third-year students in the Texas College of Osteopathic Medicine. Thank you guys so much for being here today.
Well, thank you for having us, Noah.
Today, we're going to be talking about COVID-19, or coronavirus, as some call it. And that brings to mind, guys, what is the difference? I'm hearing both of those names being thrown around in the media. What can you tell me about it?
I think that's a really good question. I think a lot of people are grouping this virus all into a coronavirus, the label, but it's kind of misleading. The coronavirus has actually been around for a very long time. We've been seeing it since the 1960s, but it comes in different forms and different variations. So this is actually a subtype of the coronavirus. It's much like there was different subtypes in the past, like there was MERS and there was SARS as well. This one, what's kind of particularly frightening about it, is actually an animal virus, is what we're thinking the origin of it was, that has come over to humans, and it's now infecting humans. So it's better to call it COVID-19 because the 19 kind of stands for the year 2019 is when it was discovered, and then the COVID gives you that it's the virus as well.
That specificity, yeah, makes a difference when we know what we're talking about. So how is this different from the flu we might see come around on any given year?
So I think the biggest difference between this and the flu is how contagious it is. Epidemiologists have a calculation for how contagious a virus is, and it has to do with all the biological and social response factors, and they call it the R naught. So for R naught values greater than 1, they'll continue to spread. R naught values less than 1, they'll die out. So for the R naught refers to every patient who's infected is expected to spread it to one patient. So the flu sits around a 1.2. That's how it survives and reproduces from year to year. The COVID-19 is estimated to be anywhere from 2 to 3. So for every person infected, it's expected that 2 to 3 more people will be infected. And what's so important about knowing that number is the social responses that we take can drive that number down. So SARS, which was another coronavirus, when it came out in Asia, the social response, when it first came out, the R naught value was anywhere from 4s, 5s, 6s. It spread very quickly. When they found out that you're only infectious when you are showing symptoms, they showed that to the public and quarantined people who were showing symptoms, brought them into the hospital, and drove that R naught value down below 1. And that's what contributed a lot to the resolution of that virus.
So are we at the point in knowing enough about COVID-19 to give general recommendations like that, or why are folks still so concerned about COVID-19 right now?
Yeah, so I think that's a really good question about COVID right now. I think we have some really strong general recommendations that we can make. Like Connor was alluding to, we can drive down that R naught value if we follow something called social distancing. Not so much what we're doing here right now, but what we really want to do is keep people at a distance from one another so that they're less likely to spread that virus to the next person, especially if that person's symptomatic, because that's when the viral load is the highest. So that's when they can easily spread that to the next person. So if a person coughs within 6 feet of you, you have a chance of becoming infected with that virus, which we can drive down that value that Connor's talking about if we actually practice social distancing. The second part of that is also hygiene, and hand hygiene is the biggest one about it. Washing your hands and making sure that you're keeping up with that, and then being very conscious about what you're doing. That includes not touching your face, things that way, because that's going to drive the virus into your respiratory system and into your body faster than anything.
So you're talking a little bit about hand washing. I know that some of the research you've been doing is concerns how long the virus can actually live on hard surfaces and other objects. Tell us about that.
Yeah, so a lot of our research has been based around cell phone contamination. A lot of the research that's out there, though, there's a New England Journal of Medicine article that came out recently, and they were showing how long the COVID virus itself can actually live on surfaces. And what they're finding is something that's pretty concerning right now, because it's looking like it can live on plastic surfaces and steel surfaces for up to 3 days. So that's a pretty long time that something can be living there that could potentially infect you. They haven't shown that it can directly infect you from these surfaces, but it's something to be conscious about. It's also been shown that it can live on cardboard for about 24 hours, and then copper is only 4 hours. So there's something inside those materials that's making the virus either live longer or die out quicker, but that's what we're trying to kind of investigate.
So I haven't had great success putting my phone in the dishwasher or giving it a bath or anything. What do I do practically to clean this thing that I take around with me all the time?
I think that's a really common problem. Our research looked at the the students here at the Health Science Center, how often they clean their phone. And your average student cleans their phone less than 1 time per week, if ever. And
Wow.
people have tried everything from UV lights to soap and water to disinfectants. And it's a really mixed bag. We found that soap and water worked the best. People who use soap and water on their phone had the lowest contamination values. And somewhat strange, people who use disinfectants tended to have just as high values as people who didn't wash their phone at all.
Interesting.
And we think that that really comes back to how the disinfectants are being used. So a review of all the different surface decontaminants that came out showed that it must remain on the surface for 25 to 30 seconds in order to fully clean the phone. Most people that were using these disinfectants on their phone were just wiping them down and then drying them off on their pant or their shirt and going on. And it's really a technique level issue.
Okay, that makes a lot of sense. So what are the methods that people use when they're using soap and water? That sounds like that's going to be the most effective for actually sanitizing your phone. What are the steps?
So I think one thing that we can do, though, I think that we can also modify things that work for the virus that we're talking about as well. The good thing that we have going for us for this virus is not a very hardy virus. So the outer coat is made up of fats and proteins. Okay, so basic building blocks that we're made out of as well. But we can kind of break down those building blocks if we use things like, you alluded to soap. Soap would be a great way to break it down. But we found that even rubbing alcohol, basic isopropyl alcohol you'll find at the store, can also break down this virus. But it's all about the technique, like Connor was getting to. Instead of just wiping down your cell phone and doing that, we recommend that you actually scrub your phone with the alcohol swab. Make sure that it sits there and lets it air dry for some time. We think that would be very effective at limiting, that sort of contaminant being on your phone.
Perfect. Guys, thank you so much for coming in and joining me today. I really appreciate you guys sharing your insight and information with us.
Yeah, thank you.
So for those of you out there watching, I'd encourage you to visit the UNT Health Science Center's website where we have updated COVID-19 information. It's a great place to keep informed. And I would also encourage you to write in at the email address that you see below. If you have any further topics that you'd like us to address or any questions, we'll be more than happy to get to them.